Madam Speaker, I rise today to share a story with you that one of my constituents shared with me and asked that I tell my colleagues about to encourage them to support health care reform. This is a woman from Broomfield, Colorado, who asked that her name not be used, but wanted the story shared, but it just as easily could have been a woman from California or Texas, Nevada, New York. This woman is a retired educator. About 10 years ago, she was diagnosed with rheumatoid arthritis. She knew what that diagnosis meant because her mother had lived with that crippling disease for 40 years. Soon after the diagnosis, she began to experience debilitating pain and had difficulty carrying out the most routine functions that you and I take for granted. Any physical exertion at all was very difficult. She researched the disease on her own, with her sons, with her doctors. They found out that there were new medications on the market which showed promise, medications like Enbrel and Humira. She asked her rheumatologist about them. He said those medications might well work, but they were very expensive and not covered by insurance. This resident of Broomfield, Colorado, waited and suffered for years. Finally, her insurance did cover Enbrel and other drugs like it, and she was able to take this new medication, and she reports that the effect was nothing short of miraculous. She now has few symptoms and is able to resume a normal life. The medication costs about $3,000 a month, about $36,000 a year. There's no way that she could pay for that on an educator's salary, and that's why she's thankful that she has insurance, even though the costs are a major sacrifice financially. And she worries about those in her condition who have a chronic disease who don't have health care insurance. The years of pain and agony that she had to go through before the treatment was covered. She tells us we need health care reform. We need preventative care for those with serious disease. She says in the long run, it'll save a lot of money and be less strain on our economy to provide preventative care. She wants us to pass national health care to cover all who need it and get good medical care. It's for American families like this, and like this story of a Broomfield resident that could have been in anywhere USA, that I call upon my colleagues in the United States Congress to join me in passing health care reform. Thank you, Madam Speaker.